and she also brings the perspective of the patient, right? Yeah. And Helen's been working at Health Literacy for a long time. She's the president of Health Literacy Consulting. She's also produced and hosted a series of podcasts, and I really encourage you, when you leave here today, to go on the internet and view a lot of those little webinars.
They're all audio
Oh,
interviews.
okay, they're all audio. See, I thought I knew what I was talking about. And she's also a founder of Health Literacy Month and the author of an award-winning text, Health Literacy from A to Z. And we actually have, could you just, through HealthLink, we've ordered a couple of copies, and at the end of the day, we're gonna have a draw, and some of you in the room are gonna be lucky winners, and will be able to walk away with Helen's knowledge in your hands. So, and like I said, Helen's been working and talking and developing concepts around health literacy for many, many years. And an indication of that is that she owns the domain healthliteracy.com. So she's definitely a pioneer in the area. So please join me in welcoming Helen today.
Thank you, everybody. Thank you for being here, for wanting to know more about health literacy. We've got a lot going on for the whole day. But I always start with a story, and let me tell you part of my story. You are sitting in your clinic's waiting room. Only this time, you're the patient. You're not the provider. Walk with me down that hall into that examining room. And while you are there, take off your white coat. Take off your stethoscope. Take off your name badge with your picture on it and get naked. Sitting there all alone in that hospital gown, waiting for the provider to come in and tell you news you don't want to hear about procedures you don't want to have. Well, I know what that was like. For 10 years ago, I was sitting there cold and scared and naked as when I was diagnosed with a very early stage of breast cancer. And I am feeling fine and doing great 10 years later, yay. But those lessons I learned will last a lifetime. I learned it is so much easier to communicate about health when we are all dressed up, wearing that professional ID rather than that patient wristband. I learned it is so, and no matter how hard it is to write an understandable, informed consent form, it's easier than signing it. And I learned to my core how much health literacy matters. And that's why I'm here. That's why I'm here with you in Ontario, Canada, Northern Ontario, Canada. That's why I've been on this health literacy journey for a long time. So that's what we're talking about today, is what is health literacy? Why does it matter? Who does it affect? And even more, what can every one of us do about it? The goals, as I like to say, as we worked on this together, is it's to go from an allergy to miscommunication, an allergy to those multisyllabic mouthfuls like myocardial infarction, when we could have said heart attack, and turn those mouthfuls into some words and terms and concepts people can understand, and turn that into action. And the action we'll be framing about is be a health literacy hero. do what's needed to communicate health information more clearly. Ambitious goals for the day, and I certainly hope by 3 o'clock when we're done, you'll have a sense of actions you can take. I want to thank everybody who did the help in this planning. Jocelyn for being part of the committee, and Ellen and Melissa. I don't know if you know Melissa, she was just key in helping plan this. Many of you filled out forms to help me figure out what exactly we're going to be doing today. Lizanne, just a great group of people. So I thank you very much. And just putting this in context, I will be using throughout some examples. And so I do tell stories, and you'll be hearing that. They come from my bias, my perspective, a clinical one and a US one. And I can't pretend that I'm anything more than that. So please take my examples, my stories, and make them yours in your settings. And as opposed, thinking about the Canadian-US differences, I was thinking, this is so different. But yes, our political infrastructure is extremely different, and I think your system is amazing, and I wish we had what you had. But aside from that, I also saw this commonalities we have and the issues we're struggling with, and the issues of keeping down costs, the continuity of care, the dealing with the transitions from one level of care to the next, having people get the appropriate services, and the core of that is understanding. So we have more in common than we have in differences. Thank you for inviting me. So let's get started. Who's been to a health literacy presentation before? Some kind. 1, 2, okay. Well, help me out as we go along. I'm glad you have, but let's take this from the beginning so we figuratively are all on the same page. Let's start talking about what health literacy is and why it matters. And please let me know if you can't hear me in the back. I have a mic, it's not on super loud, it needs to be a little bit more. Please keep reminding me, I know I'm soft-spoken and it's right here. How's that? The only way it works is if I keep looking down, which is kind of weird. So just make some motion. Also, my style, as you will hear and see, I consider it informal but informed. Ask questions as we go along. This is all about you and your learning. So only a few of you have been to health literacy presentations. At the end of the day, you'll all be able to go, yay, me too. There's some seats up here. Come on in. So what is health literacy? Health literacy is evolving. What it is, I've been doing this work. I first heard about it 20 years ago, and I read an article in the Journal of the American Medical Association about something called health literacy. Never heard that one. I was working at a hospital in one of the most diverse parts of Boston. I was working in psychiatry. People from all languages and lands. And the article said more than half of the adults in this country, in the U.S., struggle to understand written health information. I looked at my patients, looked at my handouts, that until that moment I thought were pretty good. Yeah, we got it. There's a problem here. What can I do about it? So that's my origins of coming to this. The definition of health literacy has evolved over the years. The Calgary Charter, have you heard about that? That has a basis in Calgary, Canada. There was a wonderful conference that happened here. This was in 2008. And a group of people got together, including two very prominent people in Canada in health literacy movement, Linda Chohet and Irv Rootman. And they worked with some US folks, came up with this Calgary Charter that really looked at both sides of health conversations and looked at the power dynamics in there and started putting some structure in place for that. Before this time, health literacy, when I got started, was more about the folks we're treating and caring about in there. So now they're moving forward, so it's not just kind of about them and what other people can or cannot do. It's about all of us, both sides of the power dynamic. In there, so that was 2008. In 2011, the U.S. Institute of Medicine, they have a health literacy roundtable. They came out with what I feel is a game-changing definition of health literacy, and that paper is called 10 Attributes of Health-Literate Healthcare Organizations. We will be spending a little more time on that later, but essentially what that's doing is it's looking at both sides of that health conversation. And it's looking at the needs and abilities of people receiving health messages with the demands and complexities of the messages that we're giving. And the 10 attributes are saying these need to be aligned with one another. I agree. My definition all along of health literacy, I am an OT, we're all about function. Mine has always been a functional definition, and it's in your handout too, is that health literacy happens when patients, the public, anyone on the receiving end of health information, and providers, clinicians, public health, teachers, everyone on the giving end of health communication, when we truly understand one another. And that is all along how I have been framing what health literacy is. Health literacy, what's the evidence for it? Is this just the trend of the moment? It's been out for a while. I don't think it's just a passing notion. I certainly remember in my hospital days, there were plenty of those. I don't know if you have them too. Here today, gone tomorrow kind of ideas. Health literacy's been around for quite a while. They looked at the evidence. The Agency for Healthcare Research and Quality in the US, AHRQ, looked at the peer review papers a few years ago and looked at over 1,000 health literacy studies and summarized their mega view of all this, saying the differences in health literacy level were consistently associated with increased hospitalization, greater emergency care use, lower use of mammography, lower receipt of influenza vaccine, poor ability to demonstrate taking medications appropriately, poor ability to interpret labels and health messages, and among seniors, poor overall health status and higher mortality. Health literacy matters. The evidence is showing that. Where does it matter? I think it matters all along the continuum of care. And hopefully you can help me in this part. I'll give you my take on this one, but join in on this one. Health literacy is needed for wellness. All those things we need to do to stay healthy, to do any tests to maybe detect disease, so disease prevention, early detection, all we need to do to stay healthy. It has to do with access to care. That's where the US-Canadian systems might be different. Certainly in our payment system is very different for that. But how do you enter the healthcare system? Where do you go? You have a problem. Do you go to the emergency department? Do you wait till the weekday to call your practitioner? Do you, how do you access care? It also has to do with the navigation within facilities, getting to and around facilities as well. Illness, for sure, health literacy matters. That's where the origins of the initial research was going. Is that how do we understand about disease, diagnosis, making decisions about that, following instructions. And then home care or self-care, as more and more healthcare has gone in that direction, how do we know about when to take our pills, what pills to take, what's an emergency, what are we going to do about that, how to use those new devices, and what about all those gaps and transitions in care? That's my take on where health literacy matters. What are your thoughts? Is this relevant to what it is you do? Yeah. Examples? Quiet? You won't be in a little while. Okay, so health literacy is part of the continuum. Who does it affect? And that's what I want to spend some time on, is talking about the stories of who does it affect. Health literacy sounds like, well, it just has to do with people who struggle to read, right? No, it's more than that. The origin of it actually started with the Dokes, Len and Cece Dokes, who are like the grandparents of the field. They're married, he died recently. He was a literacy volunteer, so he worked in the literacy world as a volunteer job, and she was patient education. And the two of them talked about, like, how do people understand? They did this remarkable book that's still available today, and they talked about health and literacy. That made a lot of sense in those days. Once it started picking up speed, a big pharmaceutical company came along, started to have health literacy conferences. They condensed the words from health and literacy to health literacy, and that's where we are today. So health literacy is, I talk about a range of reasons people struggle to understand. Literacy or struggling to read is just one of them. I will also be talking, just giving brief examples about issues of language, culture, disability, age, and emotion. So just a little cap in there of each one. So starting with literacy. Yes, if you struggle to read, you almost certainly will have trouble with health information, because so much is written or spoken, and that can tie in with our literacy skills, for sure. The definition of health literacy, there's new statistics that come out. The most recent group looking at this was 2013, the Program for International Assessment of Adult Competencies, or PIAC. Lots of acronyms. You should have that in your handout too. And they define literacy as understanding, evaluating, using, and engaging with written texts to participate in society, to achieve one's goals, and to develop one's knowledge and potential. There's different aspects of literacy. It's not just sounding out a word. There's different parts of it. There's continuous text, like a magazine or a newspaper, the sentences and paragraphs. There's non-continuous text, lists and graphs and maps and charts. And then there's multiple texts, which is like understanding, getting through a whole string of emails over time. So there's a lot of ways we have to be able to gather information. So just sounding out a word is not enough. It's really using it in a functional way. In these talks, I often like to mention my hero, one of my heroes, a man named Archie Willard. Archie Willard is now in his middle 80s. He lives in Eagle Grove, Iowa. Archie is an ardent advocate for health literacy. He's run health literacy conferences. He's on some many esteemed panels. He and I are on kissing terms when we go to conferences. And Archie didn't learn to read until he was 54 years old. And at that time, his wife read a Reader's Digest article. Something's funny about the example, about Bruce Jenner, who remains in the news for many, many reasons. But 30 years ago, it was because he was an Olympic athlete, which is overshadowed by the Kardashians and, oh my goodness. But apparently Bruce Jenner is also severely dyslexic. And that's what this article was about. It was about his dyslexia. Archie Willard's wife read the article and said, Archie, that sounds like you. He went to get tested. Indeed, he is severely dyslexic and not stupid, like all his teachers had told him. Well, Archie and I have this great relationship. I asked what it's like to be struggling to read, because I don't know. It's always been easy for me. I said, what is that like in healthcare settings? Does it affect the forms you get, the handouts, the teaching? And he goes, all of the above. From Archie's perspective, as well as many other people he's introduced me to, literacy does matter and does affect health understanding. But that's not the only reason. Age. Age is another one. As we age, our literacy levels decline. We might be dealing with more diseases, more chronic illnesses, more medications. They might be interacting perhaps negatively with each other. And life happens. I can't imagine really paying attention if someone told me that my family now needs to take care of me instead of me taking care of them. I'm not paying much attention that day. Age also matters at the younger end of the spectrum. I just did a podcast. I will make reference to my Health Literacy Out Loud podcast. They're all available for free. I'll tell you more about those. My latest one is with a social worker who deals with teens as they transition to adult care and all that they need to learn to assume independent responsibility from going to the pediatrician with their parents to being responsible for their own health care as an adult. Age matters at those ages too. Another reason health literacy matters is disability. As people have diminishing abilities to see and hear and remember, less ways for information to come in and less ways to communicate it out. There was an advice column in our local paper in Boston called Annie's Mailbox. And this woman wrote in, "My 75-year-old father recently had surgery, which went really well. The problem came when his doctor told him to eat moderately. His moderate food intake for the day is about 300 calories. 2 to 3 pieces of lightly buttered toast and tea with skim milk. That's it." Then she added, "It's possible that that the doctor explained his diet in more detail, but Dad has only partial hearing and may have missed the instructions." Disability matters. It is not getting enough attention in health literacy. More work needs to be done, and I hope you can add that to your challenges that you might be facing and want to address. What can we do as people have diminishing abilities to see and hear and remember? How can we communicate better with everybody? Language, that's another reason people struggle to understand. I don't speak French. I'm humbled by that. I am awed by many people in this room who are bilingual and speak French. When language has to do with the words that we use. And in the US, so many people, English is a second or third language. And then we throw in there the new language of healthcare that makes it even harder. It can take a lifetime as an adult to learn a new language and not just have the ability to talk about the weather, but really those hard how and why concepts. I want to see if we all kind of understand words the same way. Just turn to somebody nearby. For the word, I'm going to give you a word and just come up with synonyms, other words that mean about the same thing. For the word positive, how would you describe that?
Optimistic.
Okay, what kind of words? Good. Basically good. All variations of good.
Optimistic.
Optimistic. Excellent. Super. Except. Patricia, your test came back positive.
Negative.
Negative. That's the bizarre way we use words in healthcare. We speak our own language. We chose to go into this work. We spent some time learning a whole new way of using words. But we forget that that person who was ill or injured in front of us just now didn't care about learning all those words. That person is just in front of us because they have those healthcare needs. There's a whole other language out there. Another example. If I tell you to take your medication once a day, how many times do you take it? I'm not even kidding. One. The word in Spanish, O-N-C-E, is once. It means 11. People truly are taking 11 times the amount of medication because of our word choice. Words matter. So we went through language, age, words, culture too. Culture is such a factor, and it's not just a factor of maybe a country someone came from or you know, when they arrived here, but it's our worldview and our values, our beliefs, our habits, and even people who live next door, even people in my family who look, you know, same coloring as me, we can understand culture very differently. And then we have the whole culture of medicine out there. There's this wonderful book, I don't know if you've read it, called The Spirit Catches You and You Fall Down. Has anyone read that? There's a handout, there's a list of references in the back of your handout. I really recommend this one. It's written by this wonderful writer. She's not a medical person, but she wrote about this family that came over from Laos. And they came over with their precious 2-year-old daughter, little Leah. They settled in Merced, California. The book is written in alternating chapters. The family's perspective, and then the medical perspective. The family's perspective of what is going on in this whole origin of the story about little Leah, she has severe epilepsy that the family refers to as the spirit catches you and you fall down. From the family's perspective, little Leah has epilepsy because somebody slammed the door too loud. Alternating chapter from the medical perspective. This turned to be, at least at that time, the most expensive case in that hospital system in Merced, California. Tests, diagnoses, ultimately social service, frustration with the family, not following their treatment plan, all of this. Alternating chapters. The subtitle of the book is A Clash of Two Cultures. And at the end, I don't know who's right. Our system with medications and tests and diagnoses, or the family, what they want to do is just hold little Leah and bring in shamans and slay chickens. I don't know. It is a powerful book. I had heard about it. I've been to a bunch of workshops myself. I had heard people mention it. I didn't read it the first few mentions. Finally, I heard that people mention this book enough, like, okay, I'll read it already. And I couldn't stop until it was done. So I really recommend it. It can do wonders of framing that cultural issue. So the other issue I want to talk about is emotion. What role that plays in health understanding. How hard it is to listen and think and remember when we are so cold and scared and sick. And I told you my story. My story, we all have experiences like that. It's not that an amazing story. It was a big factor in my life then, but it's not. Those things happen to all of us. We hear bad news, or a loved one hear bad news. It's just remembering what that is like. Now, I saw a joke a while ago that says, research shows 60% of the population loses its memory when naked. We can all struggle to understand, and that's why I spend this time looking at why health literacy can matter to a lot of people. Literacy, yes, but age, language, culture, disability, emotion. To me, it is a human experience to struggle to understand health information. So that's how I made my little neat list. We're more complicated than that list, but that's to put it together. I'd like to turn this to you. That's why it might matter, let's say, to others. Just what you know, experience, do every day. Turn to somebody nearby if you're willing and just talk about, why does health literacy matter to you? Take a few minutes, because it's not just about them, it's two ways. Why does this matter to you?
Au moins, il fait beau pour voyager. Pour aller me voyager, c'est
Okay, I'm going to just put a pause in this. Was it easy to think about why it matters to you? Absolutely. What really struck me when you came in, we haven't been going at this very long. 2 people had been to health literacy programs. Listen to the buzz of what people are already saying, why it matters. Hang on to that. This is hard work. It takes persistence. It might feel like one more thing you have to do in your already 2 busy days. But hang on to why it matters. That will sustain you as we move forward. That is, I think, is the most precious gift you can have to internalize these concepts. Just a person or two, is somebody willing to share? You don't have to put anybody on the spot, but does somebody have a story they might want to share with the group about why it matters? Yes.
I'll share one that actually happened this week.
Just speak loud,
Yeah.
please.
So I had a patient that I sent to the emerge it was actually my husband that was working as a physician, but he speaks mostly English. It's more of a language barrier. And he told the patient that he had a funny heartbeat and that he needed to be treated for that. And the patient right away said, "Oh, I wish you could speak French. I don't understand what you mean." So just the perspective of them not understanding, he explained it in what he thought was easy kind of language that he thought that the patient would understand, but the patient did not understand what he meant by that.
So it happens all the time. So it's very real. Those situations must happen all the time. And it sounds like he tried to use the simple, short words, funny heartbeat, but what is that and what is it in life? Thank you for sharing that. Thanks. All right. Let's start looking. I'm not going to leave you at this bad place. So we talked about kind of what it is and who it can affect. Now let's go into what we can do about it, because that's really what the day is about. But I wanted to show you this little poem first by Elspeth Murray. I just really like it, and I think it'll break up what we're doing. You can also tell from my slides, I'm not just reading to you, I'm showing different ways of presenting information. Tell me this louder.
This is bad
Can you
enough.
hear it?
This is bad enough. So please don't give me gobbledygook. Don't give me pages and dense pages, and this leaflet aims to explain. Don't give me really dodgy photocopying, and do not remove for reference only. Don't give me drafted in collaboration with a multidisciplinary stakeholder partnership consultation short life project. I mean, is this about you guys or me? This is hard enough, so please don't leave me oddly none the wiser or listening till my eyes are glazing over. Don't leave me wondering what on earth that was about, feeling like it's rude to ask or consenting to goodness knows what. Don't leave me lost in another language, adrift in bad translation. Don't leave me chucking it in the bin. Don't leave me leaving in the state I'm in. Don't leave me feeling even more clueless than I did before any of this happened. This is tough enough, so please make it relevant, understandable, or reasonably readable at least. Why not put in pictures or sketches or something to guide me through? I mean, how hard can it be for the people who are steeped in this stuff to keep it up to date? Do you know what I'd appreciate? A little time to take it in. A little time to show them at home. A little time to ask, what's that? A little time to talk on the phone. So give us the clarity right from the start. The contacts there at the end. Give us the info you know we need to know. Show us the facts, some figures, and don't forget our feelings, because this is bad and hard and tough enough, so please, speak like a human. Make it better, not worse.
I thank Elspeth for letting me share that. I actually interviewed her about poetry and how that poem came to be, and she is happy that we share that. So, I want to be talking about some strategies, introducing you to strategies. The rest of the day we're going to be looking specifically at plain language, and particularly the written word, but now it's kind of an overall look at some strategies. Is this everything to do? No, it's a place to start. You might be doing a lot of these already. Honestly, pat yourself on the back and keep doing them. Tell somebody. Maybe some of these strategies are something you thought about doing or you used to do or you don't do quite often enough, and get back to doing it. Or maybe you'll come up with a new idea or two. Just take what works for you. It's really to be doing our job better, just like you were talking about your husband back there at the position. We all went into this business because we care. We really do. This just can help us do our jobs better for those we care for and care about. At first, it might feel like more work, like we don't have time, but it's really about making this a habit. And in ways it can really make our work more meaningful and efficient, because we only have to communicate it in the beginning and it will be understood. So I'm going to be going through some tips, but I want to be going through this, just find out a little bit more about you. I ask people, like, what hat or hats are you wearing? And the hats, you can be one, two, or all three. Are you a producer? Someone cranking out those nouns and verbs, whether it's speaking or writing? Are you a polisher, a manager, an editor, someone influencing somebody else's communication? Or are you a policy maker, setting the standards we need to meet? So who would consider yourself a producer, cranking out those nouns and verbs? Okay, maybe half. How about a polisher, somehow influencing somebody else's communication? Okay, a few people there. And what about a policy maker, setting those standards? Okay, all right. There's room for all of us. We are all part of the problem, yes, but we are all part of the solution. So be thinking about your different roles and what you can take from there and then. And I would almost think that you're probably all producers, but maybe not think of that exact way, but you probably all communicate health information, right? Some variety. So what can we be doing? So create a welcoming and supportive environment in how you're communicating. Now, is that just a pretty place? Well, pretty places are nice. That's not always So that's really not the gist of what I'm talking about. It's an environment in which communication happens and people can comfortably think and remember and ask questions. And it's the asking questions that I want to focus on a lot. It's hard for people to ask questions. Remember right in the beginning I asked you some question and silence. I'm thinking it's not because you didn't know what to say. It's hard to ask questions. So there have been some initiatives to help people ask questions. One of them is an initiative called Ask Me 3. Have you heard of that? This has a fair measure of success. Some groups love it and others not so much. I'm like maybe at the not so much end, but other people really like it. It's an initiative that came out a while ago from Pfizer and the National Patient Safety Foundation. And what the campaign is, it was saying that posters and signs and everything else, saying to patients, ask, if you can only think of 3 questions, here are 3 really good ones. What is my main problem? What do I need to do? Why do I need to do it? So they're creating this whole sense of Ask Me 3. And it worked to a limited extent, I think. I think what it did, from the little research I read about it, there wasn't a lot, is it started question-asking behavior, which was good. My reluctance is, are those the perfect questions? I think that they're so generic that they may not always hold up, but if you can't think of anything else to ask, or a person is not comfortable asking questions, it's not a bad place to start. And when I do presentations sometimes to consumers, they love those questions, and they keep, what is my main problem? What do I need to do? Why do I need to do it? So some groups have taken this on throughout whole systems and really like it. There's another initiative I really like through AHRQ, the same group I mentioned before, who has this campaign called Questions Are the Answer. And I'll show you a little bit from that.
Any questions?
No.
You know. We're not magicians, we can't read your mind.
Answer questions, each and every kind.
What are the side effects? Doctor.
How many times have you done this before? Will this react with my medicine?
What are all these tests even for?
I love that, it's just fun to show. But why did the Federal Agency on Healthcare Research and Quality create this public service announcement? I actually interviewed the medical director of it, like, this is fun, but why? And she said because their agency and healthcare is very interested in reducing medical error and increasing patient safety. And an excellent way to do that is by people asking questions and getting their response. That in ways personalize it. Your question might be very different from what you want to know, from what I want to know. We tend to retain what has the most meaning for us. So let's help people ask questions. Some cultures it's harder to ask questions, some ages it's harder to ask questions. There is an inequity in healthcare. We've got one person who seems all-knowing, standing up, all dressed up, and we're as vulnerable as can be as patients. That's a really hard time to think of something meaningful to ask. So these are campaigns to help with that. ARC keeps changing their Questions Are the Answer website. Sometimes I think it's terrific. You could go like, new prescription, here are like the top 10 kind of questions you might want to ask, and you can print out your own list of questions. Other times they have a very general list too. I don't know why they keep changing their website. It's not a bad place to look for you, so you as communicators can go and find out what you want to answer. Same thing for the Ask Me 3 initiative. Rather than putting the burden on the other person to ask you those questions, why don't you just, in your content, go, this is your main problem, this is what you need to do, and this is why you need to do it. You can also be modeling question asking, and you might say for, let's say you're treating someone, you're in a prenatal clinic. You know what kinds of questions people have every month, the women who keep coming in. You might frame that, let's say like, a lot of people in their 4th month really want to know about whatever. Is this something you want to know about? So you've modeled a good question. Maybe that person wants the answer, maybe doesn't, but at least it starts that pattern. The other thing to do, no cost, no time, and I'm a big fan of strategies that take no cost and no time, is saying, what are your questions? Does that seem different than saying, do you have any questions? What's the difference in there? You're implying that there are questions. I'm implying that there are questions. What are your questions? Yes. So I'm setting that tone. The other thing to add to that to do, be quiet and listen. Give that person a moment to think. What are your questions? Rather than, what's the only answer to? Do you have any questions? No. Get me out of here. So that's setting that tone that you're engaging, and it all is about the other person. I looked at a survey that was sent out here in preparation for this. In your survey, and I don't remember quite where this came from the Health Link, maybe you might know about it, or Ellen, somebody. It said, do patients and clients come prepared for appointments and interactions? So this was a local one right here. And do they bring questions? 64% of the replies were, yes, they bring questions. Sometimes, and 27% said usually. So it's not everybody. I know what I do as a patient. We're all going to be patients, right? I mean, like, or be with someone who's a patient, and probably all have scary things at one time or another. What I do, that I just figured out for myself, is, especially if it's something I'm worried about, I keep an index card and I write my questions on there, and I can start like when the appointment's scheduled. You know, I usually think of my like worst questions in the worst times in the middle of the night or something. I at least write it down. I go over that card and I bring that card with a series of my questions, what's important to me. I bring that to that appointment, and I also bring a pen. And I've discovered that, how important that pen is. I can't remember. Like, I have too much on my mind, and there's no writing implement anymore in examining rooms. It's all electronic. So I'm bringing my own pen. I don't want to be fuddling around in my purse to find something to write down the answer with. I bring my index card and I bring my pen, and what I actually do, I write down the answer. I keep my own health notebook, another strategy I learned, and I staple to that piece of paper for that appointment so I can look 6 months later and see what I asked and what the answers were. No cost. It works for me. So, question asking, is that something that you, what are your questions about question asking? How do you elicit questions where you work?
One thing you can do is prompt.
I'm going to ask you to speak up so they can all hear you.
Oftentimes, if you reflect back to them what they initially spoke about, then that will prompt more engaging answers and have them thinking about what they actually want to communicate. So it's that interaction, that communication, that dialogue, that open-ended questions that gets the answers that oftentimes the patient doesn't even know that he has the question to.
So you're probing a little bit more. Like he or she might ask about pain or something, or, you know, whatever it is. It may be that's just the entry level one, and then it goes a little further. Anybody here worried about time? Really? Really? Well, we have that in common. Everybody's worried about time. But how can you answer that? Will going down that conversation take that much longer? Well, it might take a few more minutes, maybe. But will you save later? Aren't you going through your HealthLink? You're going to more integrated services, right? And lack of gaps, is that correct? Is that where it's all going? So everyone's talking with each other. So maybe one appointment will take a little longer, but if that person knows how to take those pills correctly, then does that mean that he or she may not call you later to find out, or may not show up at the emergency room because something went terribly wrong? So it can save later on. The most expensive person working at your clinic may not always be the one who has to answer all the questions. There can be a whole team, certainly teamwork. From what I'm hearing of what you're doing, what we're doing in the US, it's all heading towards teamwork. So it's maybe not the doctor that has to answer every question, but there are other people to be doing it. There's other ways to be learning out there too. If there are a lot of questions, perhaps you might even need to say, we can't get to that all today. Let's come up with another time or way. Can we have a follow-up phone appointment? Do you want to come back in? There are other ways to address those issues. And also it's the patient's responsibility too. When I come in with my card with questions, it's not an unwieldy list. I know that the other person's busy too. I've already prioritized what matters to me and that appointment. So both sides can do something about the question asking. Let's see, another strategy here. So communicate in whatever ways work. Our fallback plan in health communication has been what? The written word and the spoken word. But there are so many other ways of communicating. Well, the written word and the spoken word, we really want to consider plain language, and we're spending a long time on that today. That means communicating in words and concepts and sentences and formats that the other person can understand. It also means teaching words they need to know. So we're going to be going through that a lot and how to go through plain language. But there are other ways to be communicating clearly. Metaphors, comparing something unfamiliar to something more familiar. I think of a metaphor like the outside and corner pieces of a jigsaw puzzle. It puts that framework that's familiar around all those unfamiliar pieces inside. Drawing pictures is very important. Elspeth Murray talked about that. Visuals are very important. The woman, she went out with a baby, it looks like, but talking about heart problems. What's the role of, for a person understanding what's the matter with his or her heart? Can you draw a picture? Can you show where this problem is? Or, how much it's occluded or what's happening where? Stories, anecdotes, quotes, music, videos, electronic ways of communicating health information. Are you dealing with electronic medical health records too? I see yes. Those are often tied into some patient education systems. Or even you can just look at the screen together and show, here was your blood pressure there, and here it is here, and here it is there. Look at how this chart is going. So you've got the visuals to do it. So I feel like we can communicate in all sorts of ways. There's no ways that's wrong. I've talk to people about puppets and, you know, movies, and there's so many different ways. For the time we've been together now, how have I been teaching you about health literacy? What strategies have I used? Stories. Pictures. Plain language. Videos. What?
Examples, like where you saying like positive, what positive means.
Having you do some interaction with
Yeah.
each other. Yes.
Humor.
Pardon?
Humor.
Humor. And it's it's interaction. There's a handout. I see you're writing on yours, you're following along. Maybe somebody's not paying any attention to it. Maybe you're writing it on it, maybe you look at it later, maybe you won't. A whole range of ways. I don't have to tell you, like, now I'm going to use a video, this and that. Why am I teaching in so many ways? Because I want to be your coolest speaker ever. No, it's not just about me. It's great if you are learning something about it, but it's about you. Why does it work to teach in a variety of different ways?
Everyone learns differently.
Everybody learns differently. And the intent is that you take away some of this message and apply it in your setting. Isn't that what you're trying to do when you're teaching your messages? Understand it enough to be able to apply it and use it. That's why we need a variety of different ways of teaching. So the next strategy, confirming understanding. If you only take away one part of these strategies, this is the one. And it's called teach back. That's with the spoken word. The written word is called feedback. But I'm going to focus more on the teach back. The teach back means at the end of talking about a key point, you ask the other person, by putting responsibility on yourself, about the understanding. You might say, we were talking, is it okay if I pick on you?
Sure.
Okay, all right, good. Okay. We were talking about all those different reasons that health literacy matters. When you go back to work tomorrow, what will you tell your colleagues about this? I want to make sure I explained it clearly. What will you tell your colleagues about it?
I think I'm just gonna tell them that like this was very like important to me because, you know, we need to speak in like clear communication. That's what I'm taking from this, is to use simple words, and I want my colleagues to understand what I'm saying.
Good.
So that's what I'm taking from this. So therefore, use other ways to be able to make sure that they are responding back and engage that communication and ask them, you know, questions after I'm done talking.
Good.
To make sure that they did understand that.
So that's great. That message is already coming through. But if your colleagues want to know, like, is it just about people who can't read? You might say this or that. So I might reiterate a point there. You might say, no, there's a lot of reasons people can struggle to understand.
That's it.
So thank you, thank you, thank you. Did you see what happened in that example? What happened? I should have prefaced it. I added it, but I didn't say the first thing I should have said. I want to make sure I explain this clearly. It is my responsibility. Did you feel like I was testing you?
No.
Okay. So you want to set that tone so that we're in it together. It is my responsibility to teach it to you, but then I'm checking on that key concept. And hearing that, did that validate like we're on the right track? The other thing I did is I owed you one more sentence. It could be just thank you, that's good to know about this or that. But I also wanted to reframe it because there was another point I was trying to find out about. So then I reframed it there and then I explained it again. That's what the teach back is about. You don't do it about everything you're talking about. You do it on the most important concepts. It's best not to wait to the very end, because then you're not going to have time to deal with it. What you want to do is ask, put responsibility on yourself, ask the other person to explain in his or her own words, like, we were just talking about high fiber foods. When you go home and talk with your husband about that, or your son or your daughter about that, what would you say about that? Or you can put it in a more functional way. When you go to the grocery store tomorrow and you're down at the cereal aisle, what will you be looking for the right kinds of cereals to buy? So you're framing it in context of what really matters. Then you owe one more sentence. If the person doesn't get it, don't just say it louder, but teach it in other ways. If you've done your very, very best teaching, you've gone through this loop a couple of times, the other person's still not getting it, then consider other ways, other mechanisms to have that person understand that important concept. Bring in a home health person, bring in a family member, write it down, there are other ways of teaching. Maybe there's some other issue going on there that one-to-one teaching won't work. Dr. Dean Schillinger is the one who came up with this interactive loop. He practices out in San Francisco General. I like Dean a lot. Yes, I have podcasts with Dean. And in one of them, I did a Health Literacy Out Loud podcast about the teach-back technique. He wrote his important paper about it 10 years ago. And I said, Dean, you're still doing this. What keeps you so enthused about it? He is so enthused about it. He is now recommending to do teach-back at the beginning of appointments rather at the end. That's where you have an ongoing relationship to kind of keep that story going. Dean said, it's one of those moments in medicine when you can actually get the patient's story. What's so interesting about medicine is the people, how they arrived, where they arrived, their resilience and their vulnerabilities. It's about maintaining your curiosity about people. Teach back is the technique to see is your message understood. I feel like I do have a better sense of you because you answered that a little bit. It's that pause, it's that check-in. And that's what we can be doing. So if you only do one thing, teach back. Yes?
Another thing is if you do glucometer teaching, a new glucometer, you demonstrate it and then have the patient demonstrate it back to you so you know what they actually got and didn't get, so you can go over it again. Or we have the nicotine replacement therapy with inhalers, so we get them to use it before they go home because 95% of them use it incorrectly, so that's another way to, I would think would be teach back as well.
It is. Nurses, I know, we talked earlier, I know you're a nurse. Nurses have been doing this forever. I mean, Dean might have put like this interactive communication loop to it, and then it got picked up as teach back technique. We've been doing this for a long time, way before this. I think it was called demonstration, redemonstration for a while, or is show, do, respond. I mean, there's another ways to be doing that. So I'm glad that you're doing it. Do you find it effective?
Yes, rather than, here you go, and we do it so quickly. Here's
And
all
you
your
do
stuff.
it, Dan, and you
Yeah.
know how to use a glucometer.
And here's the bag, see you later, put all your stuff in. So, it's easier for us because then we're not gonna have callbacks as much. I find that, I'd rather spend the time doing that than,
So dealing with the cost issues too, which we
Right.
all have to be mindful of. It might take a little longer to do that, but the payback happens with
Right.
not having the mistakes of the inappropriate level of care. Thanks. Okay, let's talk about just a few more strategies. Offer ways to learn more. We know a lot of stuff. We do. We care, we know, we want everyone to know. But how helpful is it to just spew it all out? People can just retain so much. So help them learn more when they are eager and ready to learn. And again, even if you do a handout, don't just give them websites. Don't go say, just Google it. You need a whole set of skills. Archie Willard for sure can't go Google it. He can't. He doesn't have the spelling, he doesn't know how to do search, he doesn't know how to priority, and it's not just Archie. People think if they finally do go to the internet, that just because it's there, therefore it's right, and we know that's not the case. So how do you discriminate between information that's relevant and suitable to their needs? When you come up with handouts, you might give a handout on, glucometer or people newly diagnosed with diabetes or whatever it is. Put a few resources in there to learn more. I encourage you to do more than just websites, because essentially that's reading. Is there a number to call, an agency to go to, a hotline to deal something with, a video to watch? Make sure that those are credible, up to date, and consistent with the message you are trying to be teaching there. Again, in your survey, you asked about can patients distinguish between reliable and unreliable sources of information, and 18% said never. 82% said sometimes, and 0 said usually or always. It's a real problem today. We have a flood of information. Our media is filled with information. Your job, like it or not, is helping people sort through what else they're hearing from other places. So just a few more. Weigh the ethics of simplicity. It's a term I came up with. Actually, I was at a conference in Canada, a very intense health literacy conference, and this term just buzzed around my brain at the end. And it struck me how much power we have. We are taking all this complicated, ambiguous, ever-changing information and turning it into 3 points. Well, which 3 points? Somebody else's life might depend on my choice as a communicator. That is a huge responsibility. How can we go about that in ways that are meaningful, ethical, perhaps? Are we giving people enough information but not swamping them with it? Is there a point to inform? Is it to persuade? We need to know where we're heading with this. Some people, I don't like the term, some people might say, isn't this dumbing down? I mean, I don't know if you've heard the term. I get it. It's not usually people who choose to come to these talks, it's the people who don't. My response is, it's not dumbing down. We have a commitment to communicate clearly with everybody. It's smartening up, because people can always learn more, so provide the ways they can learn as much as they want to be learning. A couple more. Collaborate for good communication. You're amazing at collaboration. From everything I've been learning about all the services that you're giving, you are outstanding at that one. But it takes all of us together. No one person owns the whole piece of the puzzle anymore. It's just all of us. It's interdisciplinary. It's communicating in different agencies, communicating with a family, communicating with the public services, our literacy programs, and our public libraries, and our police, and fire, and safety, and all of that. There's also health literacy initiatives. I know when I got started at my hospital, I very much felt as a voice of one. I was as lonely as could be in this. I got that passion right away, and no one else particularly shared it with me or knew anything about it. I then discovered and helped create some communities about it. There are now growing health literacy initiatives going on in the US. There are statewide regional ones, a lot of places. This group, your HealthLink, took this on. There's already the underpinnings there for a way you don't have to feel so alone doing this. There's also an outstanding online community if you want to join, and it's free to be doing that. A health literacy discussion list, and if I don't have it in your handout, I can send you the link to do that. A lot of people worldwide are now caring about this. Build a health literate organization. I talked about 10 ways to build a health literate healthcare organization. If you go to the next page of your handout, it lists those 10 ways. And this list is meant to be aspirational. It's not like, it's a rare group that does all those things. But it's a place to start. Some of you are policy people, or you might have influence with policy people. Where can you start making a sustainable difference? Not that just you come away with today like, oh gee, that was kind of fun and I learned something. But how can you really start taking action on this? So we're going to have a break in a moment. I don't want to spend time talking about the 10 ways now. You have them, and we have all day. If you want to talk about them more, there'll be plenty of opportunity. And then take action. And this is a theme we're going to come back to, especially at the end of the day. I coined this, be a health literacy hero. And I defined it that health literacy heroes find problems and work to overcome them. Well, it's up to each one of us to do that. And I challenge you, and I hope you'll be thinking as the day goes by, like, what might I do? As you already came up with ideas, I'm going to tell colleagues. And then you might be thinking, oh, I might do this, I might do that. So be thinking about that, because we're going to focus on that some more. So this part of it, you have all my contact information that should be on the handout. This is the Ways to Learn More part, and your handout has that too. And I just do want to thank the graphic designer I work with, who's amazing. And so helps me put into visuals some important concepts. It's just about time for a break. Do you want to, what questions do you have? I have to stop myself too.
Does anybody else find it cold in here?
Yes.
Yes.
Okay, we are
There's
going
my
to get
question.
Trudy, the black phone's over there, we're gonna ask her about warming it up. The problem with warming it up is she turns on the harder heater, it's very noisy,
Okay.
but she can do that, how about during the break, for the 15-minute break?
Okay.
Any other thing, what are you gonna tell each other? I mean, is this meeting your learning needs? Is this what you came for? Are you putting it into context? All right, well, the plan is, it's now 10:15. At 10, so it's a little bit of break. There's coffee, tea, water. Go check your electronic device.